let's continue with our topic, superficial fungal infections, and let's talk about Tinea capitis. This is one of the superficial fungal infections caused by dermatophytes. So Tinea capitis mainly affect the scalp and the hairs in mostly children of the years 3 to 14 years, but it is uncommon in adults. So it is mainly seen in children. The causative agents include anthropophilic dermatophytes, meaning that dermatophytes which are coming from the parasites. So there are two genera. There is a Microsporum odoni and Trichophyton sconrenii. Use of infected combs or hair brushes is usually responsible for transmission of infection. So I suggest you use your own brush for combing your hairs. The clinical presentation includes diffuse scarring, gray patches, black dots or broken off hairs, multiple pustules, patch alopecia, and lastly extensive alopecia with inflammation. This is a picture which shows an example of a child who is having tinea capitis. As you can see here, what do you see? You see a patchy hair loss. This region has no hair. This region has hair. What else? What else? I see white things. Mhm. These are the scales, the disquamated stratum corneum, the white scales. This is now the other picture. This one, the skin here is raised and there are pustules or papules, but also there is scales and there is a hair loss at this area. So this is also an example of tinea capitis infection. This also is another one example of tinea capitis. You can see a multiple or extensive alopecia, patchy hair loss. You can see. This also is another one picture of tinea capitis. So let's see the management of tinea capitis. You can investigate by using potassium hydroxide scrubbing. Scrub by using maybe a blade carefully. Scrub the lesions, taking away the scrapes or the scales, and you examine it by using potassium hydroxide and a microscope, and you're going to see the characteristic of the fungus. Pharmacological management or treatment includes miconazole cream, which is a topical one, 2%. You apply it thinly 12 hourly for 2 weeks, and you can continue for 5 to 7 days after clearing of the lesions. But also there is a systemic medication which you have to give. There is a tablet of glycofulvin, which is per oral. Adult is 500 milligram and the pediatric is 10 to 20 milligram per kg. You give it 24 hourly for 6 to 8 weeks. And lastly, there is a tablet terbinafine, which is per oral. Adult is 250 milligram, 24 hourly, 6 to 8 weeks. In pediatrics, it is 62.5 milligram per 10 to 20 kilogram of the child, 24 hourly, and the rest. What to note here is that tinea capitis and tinea pedis are the only teneas in which it is hard to treat because the fungus, they go deep inside the epidermis, so it's difficult to treat with a topical treatment. So most of the time here you have to use systemic medication, or you can use both topical and systemic. Do not just give topical one because it will not work. Thank you for listening, and don't forget to continue with the other video. We are going to continue with our topic of superficial fungal infections.